Hi Lori, I'm Chris.
Hi Chris.
How you doing today?
Good.
Now your physician has prescribed for you the Micro-Z garment unit to help with your diabetic neuropathy issues. I understand that from speaking with you over the phone that you have pain and other symptoms related to the neuropathy. Are the sensations as we spoke about on the phone as far as pain, is that radiating up into the leg and all the way down into the feet and toes? Okay. Now this is the garment itself you're going to see here is a very long garment that's actually going to come all the way up to just below your knee. You'll see that the garment itself is very thin, but it actually stretches, and it's designed to stretch with your body. Okay, so it's going to be very comfortable and it's breathable, so it's going to be very easy for you to wear as far as comfort and ease. Okay, now this is our Micro-Z unit here that actually connects to the stocking. The Micro-Z unit itself, it runs on a AAA battery. So when you actually put the battery in, when you get the device, you'll actually, on the back side here, you see a ridge at the top that you want to just flip that lid back, and then you'll insert your battery. You'll notice inside here there's a plus and a minus, so you just want to line that up as far as when you put the battery in. You also be able to tell that plus and minus here because our two lead wires, this is a plus lead and a negative lead. Okay? And then you simply put your lid back on. It snaps back in. Okay. Now, prior to actually putting on the stocking itself, you need to spray your leg with our Conduct Mist. Okay. It's just that. It's a conductor. It actually helps conduct the current from the actual Micro-Z stocking and the stocking itself through the skin, so it gets into nerves and tissue and other cells in your body. Okay. So it just helps intensify the current that's being introduced. Now, when you spray your leg, you'll see that it's a pump spray, okay? And what you want to do is spray your leg, starting at just below the knee, all the way down into the feet and toes. You'll actually make sure that it's evenly distributed around the leg, so it's completely covered. And also you want to get below the feet. Now, also I noticed that you have jewelry on your feet, so I'm going to have you go ahead and take off your sandals, and then also take off your toe ring. Just the 1 foot for now, because we're going to demonstrate just on the 1 foot for you. Okay? So I'm going to have you go ahead and spray your leg at this point. So remember, we're starting at just below the knee, going down into the feet and toes, and make sure it's a light mist. We do not need a real heavy mist on there. And if there's any difficulty with you spraying on the back of the leg, what you may want to do is spray some excess on the front, and you can rub it around with your hand. No, actually, this actually helps with wound healing also. So if there's any type of wound that's very serious there, it'll actually help speed up the process of the healing. Okay. Now make sure also you get at the bottom of the foot. Perfect. Okay, so once you've done that, you just want to set this aside. Now, typically we want you to wait about between 20 to 30 seconds before putting the stocking on. That way it absorbs through the skin a little bit for you. It will not be completely dry in some cases, so do not worry about that. You're not going to be electrocuted because this runs on a AAA battery. Okay? So I'm going to have you go ahead and put the stocking on. You notice when you do put it on, you have the heel portion back here, so you'll be able to line it up that way. And make sure you roll it up a little bit so you get some good leverage to get over your foot and over your heel. What you should see is that it slides up very nicely up the leg. And in some cases it may want to cover over the knee. What I recommend that you do is roll it back just a little bit over the knee, and that way it will typically want to roll back down anyway. So what we'll do is just roll it back like that so you don't have that any uncomfortable feeling while you're wearing this. Now with the Micro-Z unit, what you want to do is we're going to connect our leads. Now actually prior to connecting those leads, I do need for you to actually put this wrap. It's a Velcro wrap that you're actually going to be putting around on top of the stocking itself. This is designed to actually hold the Micro-Z unit onto the stocking, okay? And you'll notice there's a Velcro strip on the back here So when you go to actually stick it to the Velcro, it'll stick on there nicely and should not fall off for you, okay? So I'm going to have you actually wrap this around the white part, so it's basically white on white. So that end first, and that wraps over the top. Perfect. Now the next thing you're going to do with your Micro Z unit is actually connect your lead wires. Now remember, we have our positive and our negative, so we always want our red or positive connected to the top lead. So you'll notice on the inside here there is a top connection and a bottom connection. So go ahead and connect your red lead to the top or towards the heart.
Just snaps in.
Snaps in, correct.
Okay.
And then you'll snap in the black at the bottom connection.
Okay.
Great. Now I'm going to have you grab that at this point, and we're going to have you turn on the device itself and start to operate it. Now the first thing you're going to do is press your on button, which is directly in the middle, the bottom middle. And what you'll notice right now is a P1 that appears. There are two programs on the device itself, P1 and P2. Okay? For you today, your doctor has prescribed this for a nighttime treatment, 8 hours. So you're going to actually use our second program, which is the P2 program, which is the 8-hour treatment. P1 is a 30-minute treatment. That is going to be for our hand patients. Okay? So go ahead and press the on button again to get to P2. Now Lori, since you felt the unit with the tingling sensation, what I'll actually have you do is titrate down at this time. So go ahead and turn down. Now do you feel it? Okay, so you'll just leave it there, and you're taking your treatment. So all you'll need to do at this point is actually stick that onto the Velcro, which is down here at the bottom. Now there is a timer that's on here that appears on the screen. So you'll actually notice on the screen the timer itself will start at 8 hours and go all the way down to 0. Okay? At this point when it comes on, it'll say 07:59, which means you have 7 hours and 59 minutes left in your treatment. When you get up in the morning, if you've slept for 8 hours, it should be off. So if it is off, you can disconnect and go about your day. Thank you.
Thank you.
For those individuals who do not have sensation in their feet and legs, you would titrate the Micro Z unit up to 50. Now after that, if we want to titrate up any higher, you will do that at the instruction of the clinical specialist.